3 beautiful adult children now that are, I've finally figured out that just because they turn 18 doesn't mean that they need you any less or cost any less money. And so Utah Parent Center was founded about 36 years ago, and it was all in that parents helping parents. Families that had children with special health care needs or disabilities. They wanted to talk to other families, and when Mitchell Stab was talking about, I think where we all are at some point, that isolation, and so that was kind of what had started the Utah Parent Center, is just trying to get families together with other families, and then they were, and I apologize, they have gum, and I know that's a no-no, because then you'll see me. A grant opportunity came from the federal government for helping families navigate special education and 504 accommodations. So if they had children that were, going to school and not being able to get all of the things needed to get the appropriate education on their level. So that is where I think the really basis of the Utah Parent Center starting and where it is today, which is now an organization that has many different projects underneath it, not just for special education and 504 accommodations at all. We have the projects such as Family Voices that helps families navigate the healthcare world, and that's the financing, funding of special needs, as well as trying to help families, and we'll go through more in a second, really establish what's called a medical home. So we provide the free training, information, and assistance statewide to parents of children and youth with all disabilities and special health care needs by providing individual assistance, information, and referral. All of our services pretty much are free. Once in a while we have conferences that may charge, but usually it's just for the lunches that are provided and such. So in general, all services are free. We provide ongoing workshops. The basis of the Parent Center, they provide a lot of IEP workshops and 504 and transition and guardianship and all of those things that kind of across the continuum of the life of our family members to try to help not be such a complicated, isolated world, to get some of the information up front so it's not so siloed and frustrating. So all of our staff at the Utah Parent Center, I think with the exception of maybe one, and it's just because she is brand new and great and doesn't have kids, but all of our other staff, and I think we're up to 30 staff, all of us are parents of children with special needs in one way or another. And so we not only provide the information from the education we receive from our partners, but have also forged a journey along with our own children. So all of our staff are committed and passionate about the work that they do. And again, by parents for parents. So we have parent consultants, that's what we call all of our staff that are helping parents one-on-one that serve families across the state, regardless of where they're at. We have specific parents that, even though they work within the school districts, they're actually Utah Parent Center employees, so that they can have that autonomy where they are really truly advocating for the child and the family. But the school districts have, some school districts have recognized that this helps because they don't always see the side of the family, and so having these parent consultants attend IEP meetings with them, or even looking at the law, we have our parent consultants go to the special education law conference every year. So we're not practicing law, but we're helping families know where those laws are to look at and know that when when there is a disconnect between the school and the family, that we do have laws to back certain things up. And then our Utah Family Voices parent consultants, which Tina Persels is here, and she's one of them, helping families really navigate the healthcare system. So within the hospitals, the health insurance, and knowing what the resources for healthcare financing and funding are throughout the state. And then we also have what's referred to family-to-family network leaders throughout the state, and I believe we're in 15 counties across the state, where basically what they're doing is trying to bring the information and education that maybe some of our, like in Salt Lake, we have workshops all the time, but many families live, even if you're in South Jordan, sometimes that commute's an hour. So, you know, so we're trying to bring the information and opportunities for families to get to know other families into their local communities. And some of this has, in some areas such as Duchesne, they took this and ran with it, so they get very little funding from one of our grants from a state agency, and then they worked with their local community, and they fund like Halloween events, Santa events and such, again, for families to get to know other families, and they can collaborate, and they can advocate together and such. And so it's one of a growing network that we started out with just a few families and now is up to thousands. This is one of the workshops that the Utah Parent Center puts on, which is really going over those rights, roles, and responsibilities in the IEP process for special education. And then this transition from school to adult life, which has become huge now, and we're starting to see that most of the families that are calling, it's usually before, right before the child's turning 18 and recognizing that everything changes, and all of a sudden, because I've been in this situation where it's like, oh my gosh, what do I do? And how's the difference now between eligibility and, you know, to whatever we're into now. And we have a new project that has just started. It's a transition program to help try to get out to families when children are age 14 to start that planning process, and so that it's not hitting with everything, because I heard you guys talking, and just the paperwork alone that has to happen when a child is turning the age of majority. And then on the healthcare side, talking about all the alternatives, because once that your child turns 18, you're not, you know, able to access the medical records and such anymore. There's, you know, with the privacy and all of that. So knowing what to plan for, and then if there needs to be guardianship, or if there needs to be some power of attorney, so that the parents can be a part of all the decisions with medical and with financial and with adult life if needed. So again, that's a continuum of what may or may not be needed. And then Section 504 services for kiddos in the public schools. This is always ends up being a little bit of a confusing point, because it's like, well, my child has a disability or special health care need, that they are not eligible for an IEP in special education. And that's where the medical world and the educational world kind of are very different. In the school setting and the system, they are only required to do what's educationally necessary for the child, which is very different than what's medically necessary. So with Section 504 services, this is where if a child doesn't meet that need for special education, and which means specialized services to give them their education, then they may be eligible for a Section 504, and this is under the Americans with Disabilities Act, and that is what helps our children get the accommodations necessary to have that kind of equal playing field in the school system. And so that can be everything from taking tests a different way, or making sure if they do not have great, everything's not on the same level, and there's stairs, and if your child
uses a wheelchair that they can try to help set, classrooms where it's easily maneuverable and such. So Section 504 can cover quite a bit of things that would make it much easier for a child to navigate the school settings if they're not eligible for special education. And then this is a workshop that we do as well because, none of us have any stress. So, we just thought that we would throw it in there. And it is one of our highly attended workshops, but it unfortunately is not offered as much as I think it needs to be. So now that this reminds me, it's like that might be something we want to make sure we try to do at least quarterly. And communication skills. We all know that advocating for our kids is something that a role we take on, of course, because our children mean the world to us, but of course it can be so stressful. And so there are some good tools even I had to learn that I thought I was doing a great job even within the hospital setting, and realizing just even the words that I use, aggressive versus assertive, were very different. And of course many of us talk with our emotions and such, and so this has been a great workshop for even communication back and forth from those involved in the workshop to talk about just the defensiveness of the professionals on the other side as we're talking with our emotions and realizing we're all on the same page. We're just in it to make sure that we get the best for our kids. And then bullying prevention is another one that's huge, especially as we're seeing more and more families calling us and such, that the bullying is happening mostly in schools and such. And so have a great workshop on having parents know some of the tools and the resources to go to if the school is not handling the bullying well, and some pieces of information where everybody has to take responsibility to protect all children. So here's some of the other ones. The transition from early intervention into the school system. That tends to be a big, huge milestone. When Mitchell's dad was talking before about the grief and the anticipatory grief and such, those milestones are huge for any of us when we're going through transitions, and it may or may not hit us all at the same time. So some of these have been built from what parents have said that they want. They want information on how to make these transitions as smooth as possible. Because, for instance, from early intervention, there's an IFSP that's written. It's an individualized family support plan. And then recognizing as soon as you go into the public school system, then it's an IEP, and it's all about, which is good, but an individualized educational plan. And so it's all about the child at that point. And public school that's what their job is to look out and try to build upon this individual child. And that's a big shift from families, because we know that having a child, it's a part of our whole family. So a child is not separate from the unit of the family. And then the transitions, of course, into from elementary to middle school and high school are huge because of all of the different teachers and such. We also have helping the struggling student. This is looking at, again, if the child is, even if they have an IEP or a 504, looking at if the child's struggling, what are those services and supports, and how should the school be helping you? And having parent consultants at the parent center help navigate through that. And then the supports for adult success, and some of those things we were talking about before. And then whose decision is it anyway? This is big in our state right now. We've always talked about guardianship, and when your child turns 18, guardianship has kind of been the only language used with our children, and so we're trying to get more information out about what the continuum of maybe those supports, because maybe an individual does not need full guardianship, because we've had another staff just recently go through guardianship. And this is when I learned that full guardianship means taking away all their individual rights, and that includes voting. And so we really want parents to have as much information as possible so they can make their own informed choices for what works for their family and their family member, and keeping as much independence for our now adult children as possible. We have a very robust website. In fact, this I think is a little bit old slide, but trying to make it easier to navigate information no matter where you're at in the process, whether you have a younger child or whether you have an older child, to find some of that information and those supports easier. We have a lot of our workshops that we do in the community online through webinars, and then we also have videos that link to a YouTube video channel for the Utah Parent Center that goes over a lot of the different resources or information and such. And again, it's all based on what families have said that they wanted, and the Utah Parent Center responding to some of those things. We also do a electronic email, or it's called eConnections. It's a newsletter, but it comes out through email. And if nothing else, if you take nothing else away from this, I would highly suggest signing up for the emails for those eConnection newsletters, because what we try to do is if there's anything coming up that affects families with all different diagnoses, disabilities and such, to let you know what's coming up, especially during legislative sessions. So if there's changes being made to health insurance, to schools, to Medicaid services, then you kind of know up front what's going on and can respond to that or get more information, as well as any community events and such, the fun stuff. We try to get out as early as possible so families can plan on that. Here are some of the videos that are online right now. They're constantly being updated as we get more and more contracts with some of the state agencies that they said, you know, it's better for parents helping parents to get this information out than an agency such as Human Services on such things. I don't know if any of you have heard about the Division of Services for People with Disabilities. They have a lot going on, and they have a lot of services for families, but when they put things out, because it comes from a state agency, we're not seeing as many people respond and such. So they asked us if we would start helping to engage families. And again, I think it's because of that parent-to-parent model, we've been able to engage more families of saying, you know, it's great, some of the services you're offering, but it really doesn't help us. And to get that voice from families and from individuals and from children out there, what their needs really are. And I'm just going to shoot through some of these. These are some of our videos, but we have them in English and in Spanish, which is great. And then the Family Voices piece, which is that health information. And so Tina's got brochures for that too, but we always like to bribe as well. We have the fun frisbees and which is timely. The hand sanitizers too.
Yeah, grab some of this when you guys.
Yes, please do.
You're finished.
So we work with, in the state, we have a Children with Special Health Care Needs program that's just right down the street. And that is helping families that do not, I guess it's a broader range of families, because we have families that have children with severe asthma and diabetes and such, that they actually need health care plans and such in the school system. And so trying to cast that wider net so that all families feel like they have a community that they belong to. So we assist families as they navigate the public and private health care and related systems, and educate how those services and resources can help their children, and to build those effective parent-professional partnerships, because I know for me in my journey to this point, I know that the professional partners are truly my heroes, because I wouldn't be here without, and be able to speak without them making me realize that as a parent, I was doing everything right. There were a lot of things that I needed to learn and empower myself with, but it was truly because it was a partnership. And one of the things we do is, as families call us, whether it's through talking about education or the healthcare system, we listen to families, of course, and we document their encounters with the systems and such, because what we do with this is it all just goes into a database, and then it's aggregated, so there's no names with it. But when I pull data, this is what helps some of our policymakers and such at the legislature here in the state, as well as Congress at the national level. When they're making some decisions, they're actually asking us for, what are families saying? So it's one thing that, I can go and talk to the legislature about, my family and such. But it's a whole nother thing where I can say, yes, I'm a family, but here is some data from all families. And this is important to every one of your constituencies in the state. And so that's one thing that we have been so grateful for with funding that we've had to do that, because we feel like we can really advocate for the needs of what families want versus what the systems want. And in the systems of care, we're really big into medical home. And medical home, if you have not heard that term, it's your primary care physician, and it's them helping you to access the care coordination you may need if you're navigating multiple systems and specialists and such. And then, of course, the big one is adequate insurance, knowing that many of us, we may have insurance, and because, our state is great at saying, yes, we have a very low uninsured rate. Well, because of the data we capture and such, we know that, they may be insured, but they're very, very underinsured. The formulas, the DME equipment, the on and on, supplies are not covered real well, nor are the therapies. So that's the data we're collecting as well, to say, use the term underinsured versus insured, and then it will paint a whole new picture for families like ours. And then screening, ongoing screening, because many families, once you get a diagnosis of whatever that is, we tend to then put everything into that diagnosis and not realizing that there could be some mental health that they're not being screened for, and that it really, the behavior or the depression really isn't due to their initial diagnosis. It could be that they have another diagnosis, so it's that ongoing screening. And then the services are organized so that families can find the resources out there and not just happen to find out, like for us, early intervention has been in our state for years, and it's that birth to 3 resource. And I didn't find out about it, even having a child that was ventilator dependent at home, until he was 4. So we missed out on all of that, the resource that we could have had for him as he was at birth to 3 age. So, it's trying to get those, so everybody recognizes that there's some great resources in the state, just know how to find them. So this is where I'm going to bring in, if you didn't get one of these bookmarks, pick it up. We work closely with the with the Medical Home Portal. It is, I don't want to say it's just a website, it is really a clearinghouse of information that has been developed and gathered since 2000, and trying to get like almost a one-stop shop. And it's through the University of Utah as the main organization and their Department of Pediatrics, but they have information on there for families when you're going through things, but then the services and the resources is hopefully getting organized in a way, as they say, organized, in a way that a family could look for something. If you're looking for even sibling, support, that you would be able to go on and find that. And it is now more than in just Utah. It has expanded to other states, and so hopefully it will become such a wealth of knowledge that sometimes when you go on there, don't be overwhelmed because there is a lot of information, but it could help in navigating that journey. And then the decision makers, making sure that families are the ultimate decision makers in all of our care, and that's at every system level. So that's within our own educational medical systems, but also at the policy level to make sure that our children, as they grow, they have all of the supports and services they need. And then those healthy transitions of finding from going from pediatric to adult care, which has been really, really challenging for many of us because the adult health care system is very different than the pediatric. Some of the presentations and trainings that we do for the health piece is funding special healthcare needs and the emergency preparedness, which is something that we do more and more in looking at how do you, if you have a child that takes medication, and we know insurance will only cover that 30 or 90 days, whichever the prescription's for. So how do you have some on hand if, in case of an emergency where you're not able to get that prescription filled within the next couple of days? So there's been, good hints on how to do that. And then the coping and resiliency, kind of that, again, what Mitchell's dad was talking about in looking at all of the great gifts that our children have and give us and such. The wise consumer piece is really in navigating the health insurance piece and knowing about your policy so that you know how to do the appeals process and such if you know that something should be covered. We do have ABCs of autism, the healthy transitions, effective communication, and the family and consumer leadership. So if families are looking to want to be involved in advocacy policy and such. Through the health insurance piece, we talk about what Medicaid is and what the waivers and the categories are here in Utah. We also, because we get a lot of families that move into Utah, and Medicaid is very different in every single state. And so, unfortunately, we're always the ones that they call and have to deliver the bad news that even if you got that in Arizona or California, unfortunately, that it's not our Medicaid system here. So trying to be helpful into trying to find other resources. And then SSI, for many of our families, is a huge resource, and we do a lot of trainings on that as well. And then the Affordable Care Act, others know it as Obamacare and such, but what that really is and how it can help if you have no other access to insurance. And then some of the laws and regulations around commercial and private insurance and the appeals process for all of them. The medical home piece, as I was talking about, is really having that family professional partnership and having everything be family-centered and culturally appropriate, and knowing that there's quality improvement initiatives that are going on in most pediatric practices and specialty care, and knowing that families should be engaged with those. Because we all know is what families want depend on the difference between the support we already have and what we will need in our given situation. So we always talk about if you've seen one child, you've seen one child, because all of our needs are very unique and individualized. So this is just feedback that we get from the families that we get the opportunity to serve. That they, that I wish that said 100%, but 96% say that, it was very useful, practical, relevant, and high quality. And it really is for all the staff there, because we've all walked this journey, and this is where we ended up in, our work or our career. It's not a job. It's something that giving back to other families, and I have to say every time I get to take a call, I learn more from the family than I can get from them, and that only spreads along for any family that calls in. It really is one of those great resources in the state that we have that not all families know about, because you can call and basically get whatever the issue or the problem, or maybe there's not a problem. You want to know, how to access are they called golden passes for the national parks and such. So it doesn't have to be that it's a problem. You just want to know how, you can have information for your family. Tina?
And I'm a consultant, so I'm one of the people that takes the calls. And if you call and ask for something that I don't know about, I'll let you know. I'm not sure, but if you give me a little bit, I'm going to do some research and get back to you. So we really try to take that extra step to make it a little bit easier for you to navigate, and because we know how hard it is to navigate.
So with that said, call us with questions or concerns, or want to know about resource lists. So some of the things that I can say that might be, right off the bat, something that you would want is like coming up on, I know we're almost to Christmas, but talking about summer. Families start thinking, oh my gosh, what are the summer resources for families, for children and such. And every year, the Utah Parent Center and Family Voices publishes a summer resource list, so that you can kind of look and see if that, if there's things that would benefit your family, your child and such. We also have like a Christmas, that was just barely put out, right? The Christmas resource list. So if families are needing, if you know of a family that needs help with Christmas resources and such, we have a list of those now, right now, because they're so time sensitive, of course. And then we, again, if there is legislation that we know affects all families of children with special needs or adults with special needs, we try to get that out as soon as possible. And that usually will go through either our Facebook pages or this e-connections that the Parent Center puts out on a monthly basis. So I'm going to close it there because I know that we're almost out of time, and I'll let Tina say, I'm so glad you're in here, but just to see if there's anything specific that you want information on, because I know this is a high-level piece, but the Parent Center and Family Voices really truly have a lot of great resources that, again, in cooperation with professionals and agencies, have been developed for families and by families.
Did you tell them where to go on the website to fill out a form to get on the e-connections? So it's really easy. Homepage, scroll all the way to the bottom of the homepage, and it'll say, I'd like to join I'd like to get the e-newsletter. And you can click off, like, there's a few school district things that you might get more information, like if you're in the Granite School District, you might click that off if you want to have information coming from them too. It's not a ton of emails, and I like it because even I work there, and I'll get something on my personal email that says we're having this class.